Hey everybody, today we're going to talk about postural orthostatic tachycardia syndrome, otherwise known as POTS. Sonia Torre de Viaggi 2559 posted a comment asking if I could take a look at what vagus nerve stimulation does for those individuals with POTS. So I looked at a couple of studies. One was a randomized control trial. Randomized control trials are considered one of the gold standards of research. In this study, they randomized people to two groups, 12 patients in a group that had true vagus nerve stimulation and 14 patients into a group that had what they call sham vagus nerve stimulation. In this study, they clipped the clip onto the earlobe instead of placing the clip into the area where the vagus nerve actually innervates to see how this could compare across the groups. They did 1 hour daily of vagus nerve stimulation for 2 months. And then they looked at the postural tachycardia, they looked at heart rate variability, they looked at cytokine levels, and they also looked at something called anti-autonomic autoantibodies. These are antibodies that mistakenly attack the body's own autonomic nervous system. So higher levels of these antibodies are not good for your system. And what they found was significant improvements in the group that had the true vagus nerve stimulation. In terms of the tachycardia, the group that had the vagus nerve stimulation, the average was 17.6 beats per minute. And in the group that had the sham stimulation, the average was 31.7 beats per minute. And this is again after 2 months of vagus nerve stimulation. So that's a pretty marked difference between these two groups. They also saw drops in those inflammatory cytokines and lower levels of those autoantibodies in the group that had the true vagus nerve stimulation, and they saw improved heart rate variability in the group that had the true vagus nerve stimulation. So that's a really good study. It's often quoted in other studies. That's one that's kind of seen as like, hey, we really saw results here and we need to keep doing more research. There was also another study where they just took 22 patients with POTS and gave them vagus nerve stimulation for 2 weeks. And they recorded measures at baseline after the 2 weeks of vagus nerve stimulation. And then they stopped the vagus nerve stimulation at that point of 2 weeks and had them come back 24 months later, so 2 years later, because they wanted to see if any of the improvements that they saw continued even after discontinuing the stimulation. And what they found was after 14 days of the vagus nerve stimulation, they saw improved cardiovagal modulation, decreased sympathetic activity, and improved orthostatic symptoms. And some of these benefits did persist at that 24-month mark, even though it had been 2 years since they'd had the vagus nerve stimulation. So I always find those kind of studies really interesting, so I wanted to include that one. So thank you so much for being here. My name is Carissa Conrad, Doctor of Physical Therapy and Therapeutic Pain Specialist, and I am the Vagus Nerve PT, and we'll see you on the next one.